Hello to everyone watching this video. Have you ever wondered how traditional Chinese medicine, or TCM for short, is able to help your child? Today, we have with us TCM physician Janell Lee, who will share with us the common conditions in children that she sees, how parents can tell what body constitution their child has, how to improve their child's immunity, and the safety considerations when taking a child for TCM treatment. Welcome, Physician Lee. Thank you for taking time out of your busy schedule to speak with us.
Hi, Jen. Hi, everyone. My name is
Hi.
Physician Lee. Hello, hello.
So before I start asking Physician Lee some questions, let me introduce her properly. Physician Janell Lee is a TCM physician from Oriental Remedies Group. She graduated from NTU and Beijing University of Chinese Medicine with a double bachelor's degree in biomedical sciences and TCM. She was awarded the prestigious Chinese government scholarship for her outstanding academic achievements in Beijing. She is well versed with raw herbs and herbal medication concoctions. Physician Lee is an expert investigator who goes deep into her patient's lifestyle and medical history for an accurate diagnosis. As a mother herself, she's able to communicate well with other mothers and their children, allowing her to fully understand their problems. So welcome again, Physician Lee. With such impressive achievements, I am keen to get this interview started. So my first question for Physician Lee is, can you please share with us the common conditions that children see a TCM physician for, and also the common treatments for these conditions?
Thank you, Jen. Thank you for everyone for listening in today. I would say when I first started out in the TCM industry, many parents, they will bring their children over to seek TCM help for conditions such as cough, fever, common cold, digestive conditions, constipation, etc. So all these are slightly more towards the acute side. But in recent years, I do realize that there's an increasing trend in parents seeking TCM help for more chronic conditions. So this can involve having eczema, sinus, recurrent infections, where the Western doctors probably can't find a reason within, or other allergic conditions as well. So most of them, when they first seek TCM help, they will tell me, Physician Lee, I have tried many treatments and I want to find something that is more plant-based. Maybe I don't have to use any form of steroids. So that's why they come for TCM. So that's the first part. So usually, right, there are two different parts. Some parents, they come to find us because they have an issue. There's the other form of parents, they prefer preventive care. Because TCM, we believe in preventive health. So which means that we believe in a fundamental body constitution everyone has. So it requires a balance of yin and yang to prevent illnesses. So some parents do come by to let us to tell us that, hey, I want to boost my child's immunity. I think the reason underlying this is because a lot of children, they enter the childcare centers at a very young age, some as young as 2 months old. So as a result, because of the interaction with different kids, and at that point of time, their immunity may not be as developed as adults, so they tend to fall sick very often. So that's why they come to us and say that, hey, I want to improve my child's immunity so that they can fall sick lesser. So in TCM, if you ask me about the different treatments, we have the more conventional kinds, like taking herbal medication and acupuncture treatment. Some parents, they want a non-invasive way of treating their child. So we do have pediatric massage as well that helps with regulating the 5 organs in our body, as well as improving digestion and improving immunity for kids. So I would say that before we start all these, right, we will require a very thorough diagnosis. So when patients come in or anyone comes in, we will have to know their overall condition, the underlying medical condition, and we will observe their tongue color. We will take their finger the index finger. So this is opposed to adults when we take their pulses. So for kids, we usually look at their index finger. Yeah. So from all these questioning and looking at the tongue, looking at the fingers, so we'll be able to derive a body constitution for the kid. Then we'll let the parents know what's the underlying cause of their condition. Yeah. So so I would say that treatments are pretty wide, dependent on what parents want actually. Yeah.
Great. So you mentioned baby massage. And so how different is baby tuina from the Western baby massage?
I would say both pediatric massage and baby massage, they serve the same purpose to treat certain conditions that babies have. So the underlying basis for pediatric massage, especially, it's based on TCM concept. So it is the balancing of the 5 organs in our body. So for people who may not know, it is the heart, our lungs, spleen, then liver and kidneys. So the interesting thing about pediatric massage for TCM is that a lot of the acupoints are found on our palms. This is as opposed to baby massage where they utilizes the whole body. And in fact, before I stepped into the industry, I do have patients telling me about how they massage their kids at home. And when they see, why do I spend so much time on their hands and I didn't do the other body parts? So I'll always explain the whole theory of the 5 organs just based on the hands, and they will be, oh, okay, so it's different. Yeah, so I would say that the underlying basis is different, but since the both of them help in certain conditions, when patients ask if can I do this at home, can I do the Western massage at home, I would say yes, you can continue to do so. But you come to find me, I will do the traditional pediatric massage for you.
Okay, sure. Okay, so thanks for explaining the difference. And you mentioned about herbs as well. So I see children with special needs. So can herbs be used for children with special needs, as many of them have other medications that they use?
Okay, this is first we will have to know what kind of condition the patient has. So special needs, I'll assume that probably some of them are still able to take in medication through ingesting, right?
Yes.
So for this kind of conditions, as long as the intake of the medication is 2 hours before or after the Western medication, there wouldn't be much of an interaction of the medication. So likewise for patients with or children with special needs, we have other children with chronic conditions like eczema, and they require some steroids, and they will always couple with herbal medication. So when I issue medication, I will let the parents know beforehand.
I see. Okay, great. So now, due to COVID-19, parents of children with special needs are concerned because children with special needs tend to have lower immunity. So from a TCM physician's perspective, what can parents do to improve their child's immunity?
From a TCM perspective, having a low immunity is relevant to something we call qi. So I'm not sure if you know the theory of qi, then?
Roughly, it's about energy flow and something like that. Okay.
So qi is actually the vital life force in our body. So we believe that the strength of our immune system, it is dependent on the strength of our qi. So which means sufficient qi, strong immunity. So to strengthen that qi, usually for children for special needs, right, that I can probably share a few tips that can help. Yeah. So the first lifestyle tip will be the intaking of food. So we always believe in the balance of yin and yang, right? So in terms of diet, when we take in food, it should be a well-balanced diet. I have patients who have kids who prefer a certain kind of food. So when I talk about well-balanced diet, it should have a combination of carbohydrates, of proteins, and even vegetables involved, and certain fruits. Because fruits and vegetables, some have very high antioxidants, which will help with kids' brain development as well. Yeah. Then after that, from a TCM perspective, it is better for children to avoid food that is too spicy, too dry, or probably that's too cold in nature. Because why? For kids, as all of us know, their immune system are not as developed, so their digestive system is not very developed as well. So taking food that is too oily, too spicy, or too cold, it can harm their digestive system. And and it is not good in the long run. It can compromise the immune system as well. Yeah. So on a regular basis, right, when you want to strengthen your qi or you want to strengthen your immunity, you can take food or fruits, or maybe I'll share some TCM herbs, something called 四神汤. If I do a direct translation, it can be like 4 fairy soup. It involves 4 different herbs. If you go to a medical hall and you say, I want 四神汤, they will be able to prescribe everything for you. Yeah, so it is quite a common soup that people drink on a daily basis. So for kids or even adults with low immunity, we have a decoction called 玉屏风散. It is actually a TCM decoction which involves a particular herb that helps with nourishing the qi and strengthening immunity called 黄芪. Yeah. So this herb itself, it is very good in nourishing qi and help with kids with lower immunity. So if you want to find something that is slightly more natural, there are actually more organic options available. I wouldn't say organic, maybe more natural options available that has pesticide-free 黄芪. Maybe they can go to the medical halls and take a look at themselves. So that's for the lower immunity part. So the first one will be food. Second one will be lifestyle habits. So lifestyle habits involve the sleeping habits as well as the emotional state. So maybe I share more about the emotional state first, because emotions are very important because it can have an impact on our own physical well-being. For children, it is the same. So to help with this emotional regulation, right, for children, even for babies, appropriate exercise. And sometimes some of our patients, they do acupuncture, even for kids who are not afraid of needles, they do acupuncture to help relieve the stress. And I understand that because we are staying in Singapore, and sometimes I know of kids who start tuition as young as 2 years old, 3 years old, and they are exposed to all this information at a very young age. Then they can feel stress at times. They can have vivid dreams, and they can have nightmares. And usually, herbs and acupuncture can help to regulate this and relieve the stress. And for sleep-wise, we believe in yin-yang balance. So it will be better if children can sleep slightly earlier. Although for adults, we have a beauty sleep time 11 a.m. to 11 p.m. to 1 a.m. For kids-wise, it is better to sleep slightly earlier so that it can help with their brain development as well. There's a saying, right, in TCM called 胃不和则卧不安. Do you know what that means?
No.
Actually, it boils down to our digestive system. So why do I say eat, your sleep, your emotions have to go on par? Because why? If our digestive system is not good, it can affect our sleep. So we have to take note of the food, emotional stress that will affect our sleep. So these two portions have to go hand in hand. Yeah. So for children with more chronic conditions, I would say where they have a lot of symptoms in play, it is better to seek consultation, because why? The different organs that are involved may have different imbalances that we will need to identify. So we usually do pediatric massage that is not so invasive, and it is more generally accepted by kids because we can help to balance the yin and yang, balance the 5 organs, and help with the digestion for children. Yeah, and the good thing about pediatric massage is that we can teach you guys, or we can even teach parents what to do so they can do it at home. Yeah, so I find it a very convenient choice. Even I do it for my child at home as well.
Okay, so you mentioned yin and yang quite a few times. And I think it brings me to my next question, because I understand that people are either of a heaty, cooling, or a neutral constitution. So is that considered yin and yang? Because can you please explain to us what constitution actually means, and how can parents determine what body constitution their child has?
Yeah, right, Jen. Yeah, hot and cold actually really belong. I would say that hot and cold is part of yin and yang. So having a yang body constitution is more heaty. Having a yin body constitution is more cooling in nature. So if you ask me whether a child has a heaty or cooling body constitution, it is actually the most basic form of constitution that we have in TCM. So how do we identify it? But having a heaty body constitution will mean that a child probably can have symptoms such as a flush face. So when you see the facial color a bit more red, right? And they have a slightly redder tongue. They sweat easily, having constipation. All these all belong to the heaty body constitution. The cooling body constitution, we can see that the patient, the child or the person looks a bit more pale, and cold hands and limbs, slightly looser stools. These belong to the cooler body constitution. I would say that for children especially, we can't actually find a person or a child with a neutral body constitution due to the underlying TCM concept, which believe that when a child is below the age of 6 years old, our organs are still developing. So in fact, our heart and liver fire has more of it, and our lungs, spleen, and kidney, it is more towards the weaker side. So actually, you will realize that kids, they are warmer in nature. They tend to feel hot more easily. So that fire will be there. So I would say that it is rare that we can find a child with a neutral body constitution. So can parents identify whether their children is hot or cold? Yes and no. If they can see the facial color, just by looking at the facial color or the tongue color, we can identify. However, sometimes there are constitutions that is pretty hard to identify. I would say that they may not be so direct. Maybe I share with you one of the body constitutions, such as qi deficiency, which we see often in patients with chronic conditions, like some conditions that they have since young, since birth, or probably conditions such as sinus edema. Most of them belong in the qi deficiency sector. So we can't classify this as yin or yang. So in treatment, what we do, right, we will have to nourish that qi to give them the boost in energy in terms of treatment. Yeah. So I would say that qi deficiency, it is quite common in Singapore nowadays. So if you are curious, maybe if you find your child having lesser energy as usual, maybe they can tend to get breathless at times. So this will belong to the qi deficiency segment.
Okay, so based on your description, it sounds like my body constitution is towards the heaty side.
I can look. Yeah, I observed that as well.
Yeah, I tend to have a very flushed face, isn't it?
That's actually very good.
Is it? Okay. So how does, having either yin or yang, how does that affect the diet?
You mean what kind of food we can take, is it?
Yes, that's right.
This goes both ways. If we are more towards the heaty constitution, of course you have to avoid things that are too heaty, because if you eat for example, if you have a heaty body constitution and you go and eat durian, chances are the next day you have sore throat, you have constipation. Yeah, so for this kind of body constitution, usually you have to opt for food that is more cooling in nature. Food such as maybe green bean, winter melon, all these are slightly cooler in nature. So for constitutions that for colder body constitution, usually you will have to avoid things that are too cold in nature. Probably I would say that bubble tea that maybe some children like to drink, and maybe they will have to avoid watermelon. They have to avoid things that are more cooling in nature. They can opt for something slightly warmer, for example, maybe slight ginger. Or maybe when in their bowl of soup, they can add a little bit of pepper. That is slightly warmer in nature. So this goes both ways. But the thing is that clinically, right, I see quite a number of children patients, and I would say that if we were to classify based on hot and cold, it can be a bit generalized. But of course, if you have an indication, it will guide you in terms of what kind of food you can take, what kind of food you cannot take.
Okay, great. Thanks for that very detailed explanation. So I would like to move on to the safety concerns. Are there any safety concerns regarding a child going for TCM treatment?
I would say that TCM treatment is generally considered safe. And from at least to now, in my years of experience, the side effects for any herbal medication, it is pretty rare or minimal. So I would, maybe I should set aside individuals who may have certain form of allergies. I will touch on that later. I'll talk about acupuncture first. Acupuncture, I think a lot of people are concerned because it may be painful and it may cause bleeding, stuff like that. So generally for acupuncture, you will definitely feel something, but it's just an endpoint. Then there may be slight bleeding or bruising after acupuncture, but usually the effects are quite limited, quite short term. So there wouldn't be any long term safety concerns as long as you find a registered physician or practitioner to help with the treatment. Whereas and for the herbal medication wise, I believe that it's communication with the physician who is seeing the patient or any child, because I do understand that there are different child with different kinds of allergies. For example, some kids they are sensitive to gluten, some kids they are sensitive to maybe I would say seafood. Some kids they have fundamental conditions such as G6PD. And for all these conditions, right, there are certain kinds of herbs that we may have to avoid. So this requires a communication between the patient and us. For us to identify what kind of condition you are, you tell us your medical history so that we will have to take note of that. Yeah. So for any form of safety concerns wise, I feel that communication it is the key for everything.
Yeah, that's right. I mean, the communication between a practitioner or professional and the client is actually really important. Okay, so thanks for highlighting that. And basically, my last question is: how can parents contact you if they would like TCM treatment for their child?
Currently, usually the consultations are done in our clinics. So over here we have 2 clinics, one in East Coast, and the other is in Jurong East. So we also have a clinic line, so patients can usually do a direct WhatsApp over. So I'll probably share the number. Let me check. The number is 87422163. 87422163. So we do have a very dedicated or very friendly team of members who attend to the WhatsApp line. So if anyone were to make any inquiries, they will be able to help them. Yeah.
Okay, great. So I will share the contact details in the comments section below. So thank you once again, Physician Low, and thank you all for watching this video. Stay well and healthy. Bye-bye.
Okay.
All right, and you're done. That was good. It was like in one take.